So, good morning, everybody. Um, First, that all, I would like to thank you for all the subscribers to our YouTube channel. We are increasing the numbers of subscriptions, and that is very nice for the channel. We are trying to improve new kind of live transmissions for you, and to be more specific in some kinds of cases, trying to avoid big cases or very difficult cases that could take a lot of time. So we are working on that. I would like you to invite to be part of the Enda Club. So visit the webpage www.pentaxcenter.com and subscribe in our platform is for free. So you will receive a newsletter in your emails with new technology and the new advances in endoscopic techniques. So today we have a very interesting case. We have a 19 years old woman with acute pancreatitis recently, and with a complication of this pancreatitis with pancreatic pseudocyst. This patient now have fever and abdominal pain, so this is a formal indication to have a drainage of this this collection. And at the same time, in a second step, we will perform today, but not live. We will perform an ERCP because of biliary stones. So today I will show you a little bit, or remember you, because we have some videos regarding the use of lamps for US guided pseudocyst drainage. But today I would like also to show you the new US scope from Pentax Medical that we have in our unit. This is the new scope. It's a new design of a scope. This is the J10 UT series. There is a change of the tip, as you can see, and also in the working channel. So we have now 4.0 working channel. Is very ergonomic US. It's less heavy also, and this is one of the big characteristics. We are using the new Aloca Arieta 70 from Hitachi Aloca company, and I will show you how this scope have a very nice resolution and very good quality of image. And I will explain also how to deal with these kind of cases. Okay. So so now we are in the esophagus. We are observing the mediastinum with all the anatomical aspects. So I am going directly to the stomach. We are observing the liver here. There is not any dilation or any kind of lesion, at least at the first impression. And now I am in the stomach. I'm trying to pass a little bit, and we are looking for this collection, fluid collection. I would like to see first my pancreatic, my pancreas. So we see here the splenic veins and artery. And you see the splenic, the spleen here. And this is the collection. We have some wall of necrosis areas, but they are very small in comparison to the whole collection. So I think it's less than 15% of the collection, and there's not any necessity, or this patient doesn't require any kind of necrosectomy in this case. Okay, this is a 7x7 pseudocyst. You can see also the quality of the image of the scope, and using lamps give us a little bit some good advantage, and these are that in this kind of cases necrosis will go out through the orifice of the lamps. We need to remember, I will use today the hot axios lamps. We have different kind of measures, and for pseudocyst we have the 10x10 axios, hot axios, and we have also the 15x10 and the 20 millimeter of diameter. For this case, I believe that the 15 millimeter will be fine. We don't have a lot of wall of necrosis signs inside the pseudocyst, and I think should be good, a good election to use the 15 millimeters hot axios. One of the big advantage of these lamps is that we don't need to use bottom dilation. Is a single step drainage. Ábrelo. And one of the most important tip now is to try to see if there is no vascularity in front of our wall, and second, to measure of wall, we need to go to the less diameter of the wall to try to do this. So this is the hot axios from Boston Scientific. This is single use with single steps for lamps delivery, and we have a cautery in the distal part of the catheter. So we will pass this through our endoscopy channel, and you can see here in the handle of this hot axios we have different steps. As you can see here, we have very well designed the steps. We have one, the second, the third step, and the fourth step that we need to follow to do our procedure. So now I am here in the level of the stomach, and I am looking for any kind of vessel before to do my drainage. So I am very good. I am fine. I am sure that I don't have any vessel, and I will start my drainage in this side. So I am connected now. I am using our RB electrocautery with the effect 5 auto cut, and with the upper maximum of 100 watts. So now I am in a good position. So now I am inside. As you can see, I have my catheter here. You see here? This is my catheter. And now I did my first step. Now I will do my second step, that is to go up with this handle, and we will open. You can see in the US very well the open of the distal part of the lamps, and then I need to push and to create this this kind of image, as you can see here, before to perform the fourth step to deliver my lamps. Normally I deliver this inside the channel because this will give me more security, and you can see here the second part very well delivered inside the stomach. So you can see here both the distal part and the proximal part. The proximal part is inside the stomach. We have here the stomach, and this is the probe. So we already finished our procedure. I will retire this. ¿Podemos mostrar la imagen endoscópica? So as you can see, it's very fast way to perform a drainage. We see a lot of pus inside. All the advantage of this new US scope is that we can do a retrovision, as I am doing here. So I am performing a good aspiration. I cannot see my lamps, but proximal part of my lamps, but I am sure that we are inside the stomach. So you can see here let me see, where's my lamps. I think it's here. You can see picture. So it's a very good position, very good drainage, and I will show you the complete drainage of the fluid collection here in the stomach. I don't see more the collection. A little bit here. So this is in 48 hours or 72 hours probably will be complete drainage. It is very important to perform a control by US in 15 days just to see if the collection was completely removed or drained, and in those cases to retire the Axios stand here. So I finished my transmission. It's very good demonstration. Thank you so much for your attention. We will have more cases today, probably a radio frequency in the pancreas. This is a very new technology, so continue with us, and thank you.